Johne's disease was founded by Dr. Johne in 1894, and the first case in the U.S. was discovered in 1908. Johne's is a disease that is not commonly heard about and is caused by the bacterium of Mycobacterium paratuberculosis. When this disease was discovered, it was clear that the same bacterium was in tuberculosis for birds. Johne's disease only occurs in ruminant animals that chew their cud, such as sheep, cattle, deer, goats, antelope, and bison, but is most commonly found in dairy cattle. Johne's disease is found in the cow's manure and in the soil. So when a calf is born, it may breathe in some of the bacterium of the soil, or it may get some manure in its mouth when a calf gets a drink. Once the bacterium is in the calf, it slowly starts making its way down to the small intestine. It may take about a year or two before it reaches the small intestine. When it does reach the small intestine, it goes inside of the cell wall and expands. When it starts to do this, the cell wall instantly thickens, makes it almost impossible for the cow to absorb nutrients anymore. Once the bacterium has settled into the cell wall and expanded, the cow starts to show symptoms of Johne's disease, which are rapid weight loss with a normal diet, diarrhea, poor milk production, and swelling under the jaw. It may take a long time for human eyes to detect Johne's disease in a cow, so there are some ways to determine if a herd of cattle may have Johne's disease. One way is to use body conditioning score. What body conditioning score is looking at a cow's rump, tailhead, or loin area. The score is based on the amount of fat in these areas. The scale is 1 to 5 with 0.25 increments. The cow that has a low body conditioning score is more likely to test positive for Johne's disease. The next step would be to take blood samples of the herd of cattle. This would be done by lifting the tail and taking samples from inside the tailhead. Another way of testing Johne's disease is to test the soil and the water of a farm. Places where you could suspect Johne's disease would be in a cow barn, maternity barn, spray field, or retention pond. The ways you would collect samples would be to go out into the barn or field that you would want to test and take about 5 random 20-gram samples of soil or manure. Then label and ship them to a laboratory to have a bacteriological culture for Mycobacterium paratuberculosis. To test a retention pond or lagoon, make a device that can sample water, such as a fishing pole with a gauze on the end. Once the sample has been taken, label and ship to the same laboratory for similar testings. Johne's disease is easily transmitted through cattle. If the dairymen do not detect that a herd may be infected with Johne's disease, they may lose their herd and suffer financially. Johne's disease is a serious disease that is kind of related to Crohn's disease in humans. But there has been no connection of Johne's disease and contact with humans or milk consumption in Crohn's disease. There is no vaccine for Johne's disease, but you can test the soil and the cattle for Mycobacterium paratuberculosis.